Hello, my name is Charity McDaniel, and I am a student who is currently pursuing her master's degree in nursing education at National American University. Today, I'm going to conduct an in-service about endometriosis. The name of the in-service is called An In-Depth Understanding of Endometriosis. Sit back and enjoy the presentation. The purpose of this in-service is to educate nurses in a small rural hospital about endometriosis. In 2018, many researchers have discovered that endometriosis is a disease that affects women nationwide. Therefore, a lot of nurses in small rural hospitals are not aware of these signs and symptoms, nor are they aware of how to treat the disease. So it is very necessary for nurses who work on a GYN unit to understand what endometriosis is. Hi, ladies and gentlemen. This special in-service is for you, and as I stated earlier, the purpose is just to teach you a few things about endometriosis. By working here at this small rural hospital, there are a lot of things that you guys are not privy to, and I thought that it was very important as the educator to inform you about endometriosis. So, sit back, get your pens and papers out, and get ready to learn. Thanks. There are a few objectives that I want the nurses to know at the end of this in-service. The first one is I want them to understand and to be able to identify the signs and the symptoms of endometriosis. I also want them to be able to identify and name the diagnostic test as well as the findings from the test. I would like for them to describe or discuss two medical treatments and research that relate to the medical treatment, as well as two nursing interventions and research that is related to those interventions at the conclusion of this in-service. Now, the first question that we want to address is, what is this disease called endometriosis? This is something that is commonly discussed but very uncommonly understood. It's simple. Endometriosis is a disease of the uterus and of the additional female organs. What happens is the endometrial lining, which is the lining on the very inside of the uterus, the tissue grows on the outside of the uterus, on the ovaries, the fallopian tube. It can even grow on the rectum. It can grow on the bladder. It can go on the lung and also on the brain. And this tissue, when the time of menstruation takes place, it acts like the endometrial tissue. So everything that the lining of the uterus does during the time of menstruation, this tissue that grows in other areas of the body acts or mimics the endometrial lining. So it's a very serious thing, and we'll go more into details about this as we transition throughout the in-service. Let's talk about the distinct signs and symptoms of endometriosis. The biggest sign of endometriosis is what we want to describe as killer cramps. These women have cramps that put them down that very first day of their cycle and also throughout their entire cycle. The women are bedridden, they're unable to go to different events, and these women are in excruciating pain. They have long periods, they experience heavy periods. They also experience pain during sex and different bowel and urinary disorders. These women have frequent urinary tract infections, and they also have difficulty having bowel movements. And unfortunately, one of the biggest symptoms with endometriosis is infertility. Yes, these women are unable to achieve pregnancy because of the endometrial tissue that is growing on the ovaries and on the fallopian tube. So if you know of a woman or you yourself are experiencing these symptoms, then you definitely want to get checked out. And we'll talk about what that word means or what it means to be checked out with endometriosis. All right, so endometriosis diagnostic test and findings. One may ask, well, Charity, how do you know that you have endometriosis? Or how can you definitely determine if a woman has endometriosis? Well, those are good questions. So this slide shows a few diagnostic tests that determine or help to identify whether or not a woman has endometriosis. MRI, that's one of the tests that you can do to determine whether or not you have endometriosis or an individual has endometriosis. The MRI reveals endometrial implants and it helps with planning surgery. The pelvic exam is another diagnostic test that can be performed to identify if a woman has endometriosis. A pelvic exam reveals scars, cysts, and also endometrial tissue, and the doctor will perform the pelvic exam and can feel those different things. A transvaginal ultrasound. Now, a transvaginal ultrasound is a very common procedure that is performed for women with different types of GYN issues or gynecological issues. But in this particular case, it helps to reveal cysts that are caused by endometriosis, but it does not definitively tell whether or not endometriosis is present. Unfortunately, in order to definitively tell whether or not a woman has endometriosis, she has to have a procedure, a laparoscopy. And this procedure, and with the procedure, the physicians go in and they get to see through the scope where the endometrial tissue lies, and it can be removed by cauterizing it. And for those of you who may not know what cauterize means, it means to simply burn it. So these are the tests and these are the findings to determine whether or not one has endometriosis. Now that we've talked about the symptoms, we've talked about the diagnostic tests and the finding, let's talk about the different stages of endometriosis. Endometriosis is from mild to severe, from stages 1 to stages 4. On this particular picture, there is an assessment scale. This is what I'm showing. And the assessment scale talks about the points and the stages of endometriosis. And I'll go into more details about the different stages of endometriosis. Like I said in the previous slide, the only way to definitely determine if you have endometriosis is by doing a laparoscopic procedure. Now, in the first stage, you have minimal endometrial implants in different areas of your body. And as you can see, that's the very first picture in the square on the left-hand side at the top. You really can't see, there are just a few along the uterus. On the second stage, you have mild and more deeper implants. Throughout my research, I discovered that endometrial implants are described like icebergs. You only see the implants on the top of the uterus. However, the implants go deeper throughout the uterus and in the uterine tissue and are planted past the surface, and that's why it's difficult for them to be removed and why it causes so much pain, like an iceberg. With an iceberg, you only see what's at the top of the iceberg. You don't see that deep root of ice that's underwater. So with stage 2, like I stated, there are deeper implants. Stage 3 shows moderate and mini deep implants. You also may have small cysts on your ovaries, and you also may have some adhesions. So as we can see, the picture of stage 3 is at the bottom on the left hand side inside the square underneath the picture of stage 1. And it's the darker blue, and the darker blue reveals those deeper implants and the adhesions, which is kind of the stretchy part, and that's what more severe. Unfortunately, stage 4 is the worst type of endometriosis that a woman can have. That's the last picture. A lot of adhesions, many implants. It's on the cysts, it's on the ovaries, and unfortunately with this one, this is where it's really difficult to get pregnant. And stage 4 normally spreads to the brain, and it can also spread to the lungs and the thighs and a lot of different places. So these are the 4 stages. This is the assessment by the American Society of Reproductive Medicine. So stage 1 is 1 to 5 points. Stage 2 is 6 to 15 points. Stage 3 is 16 to 40, and stage 4 is greater than 40 points. So these are the stages, and we'll go into more detail about them later on. Okay, now that we've discussed the symptoms and we've discussed the diagnostic and findings, let's talk about the medical treatment or the intervention. There are 2 ways endometriosis can be treated, or interventions for them. It's a non-pharmacological and pharmacological, with the medicine or without medicine, or it could be medicine and surgery combined. The treatment for endometriosis is determined based on whether or not a woman wants to achieve pregnancy. For those women who do not want to achieve pregnancy, then those women will get on the hormone replacement therapies or take the birth control, and could possibly have hysterectomies to have those female organs removed. For the women who are trying to achieve pregnancy, they're going to have the laparoscopic procedures, and they're going to have the different surgeries in addition to laparoscopic, additional surgeries if they need be, and different type of fertility medications to help them achieve pregnancy. So recovery time post-surgery is usually about 8 weeks, and the best method to get pregnant, or I guess the time frame to get pregnant, is within the first 6 months to a year after surgery. If surgery is not achieved, pregnancy, is not achieved, then women may have to go back and repeat the surgery. The surgery does not cure endometriosis. It just relieves the implants, the endometrial implants, so that the women can try to achieve pregnancy. If they try to get pregnant and they achieve pregnancy the first time, but then endometriosis comes back the second time, they'll have to have another surgery to achieve pregnancy. So it's a very serious thing, and it's something that's very common. And like I said, it could causes a lot of women to have infertility. So there's a medication for the women who are just trying to control it, and the birth control does not get rid of it. It just helps to slow down the progression of it and relieve the pain. And then there's the surgery. NSAIDs are the medications that can be taken when women they come on their cycle, and that's decreasing the inflammation to help control their pain. So these are the medical interventions for endometriosis. Now, at this point, I would like to share a personal story with you guys. The reason why I chose this particular subject is because I believe that I suffer from endometriosis. From the time I was 10 years old, I have had what we call the painful periods or the death cramps. And I'm very passionate about this subject. I've gone to, don't have any children, and I've gone to the physicians, and they've seen cysts, possible polyps, and couldn't definitely tell me whether or not I had endometriosis, because I have elected not to have the laparoscopic surgery. However, that is something that I would have to do to definitively tell if I have endometriosis. So I am a witness. I have had the transvaginal ultrasound. The ultrasound did not reveal endometriosis. It did reveal those things that I discussed earlier. So in looking at medical research or medical interventions, there is a group called the ROSE group, and it's Research Outsourced Endometrial Study. And this research group was put together for women nationwide to try to figure out what needs to be done for endometriosis. What they do is they look at genetic markers with the endometrial tissue, or for women who have endometriosis, and also for women who do not have endometriosis. A lot of research is going forward with endometriosis, and there are some great outcomes. If you can see here on this slide, the website, feel free to go to the website. But there is a lot of research, and they're still looking for research participants, and I plan to participate in the research study within the next year. But the ROSE group, which is Research Outsmart Endometriosis Studies, is looking at women who do have endometriosis, the signs, and who don't. And so for any of you who may know someone who suffers from endometriosis or just support women as a whole with different gynecological issues, feel free to check out the website and participate in the study. All right, we're going to move on to the next slide. All right, let's talk about some nursing interventions that are related to the caring for someone with endometriosis. Of course, one of the things that a woman that suffers from endometriosis is going to have is chronic pain. And the pain is related to those endometrial implants, those pelvic implants. So you want to make sure that as a nurse taking care of someone with endometriosis, that her pain is under control. You want to make sure that she has an NSAID on file. You want to also make sure that if she's not taking NSAIDs, that she has birth control or some type of hormone therapy that will assist her with controlling the pain. Another diagnosis for women with endometriosis is going to be anxiety. These women are going to be have anxiety because of the infertility. As women, we all know that having a baby is something that we say marks our womanhood. And I can speak to it personally that not being able to achieve pregnancy can cause a lot of anxiety for a woman. So you want to offer your support, possibly offer a 1-800 number or a help group so that women can find support. There is a group out there called Endo Speaks, and I'll also post that at the end of the information so that we would know as nurses how to assist and support women with these diagnoses. Another one is deficient knowledge related to the diagnosis and the treatment options. It's one of those things where you're just told, oh, you just having pain, and that's common for coming on your cycle. But the type of pain that women experience with endometriosis is not a common pain. It is a severe pain. So they need education about what's going on and how to manage the disease that they're experiencing. So deficient knowledge is another one. So as nurses, we want to get out there and do research and have information for our patients. The last one that I want to discuss with you all is the ineffective sleep patterns, sexual patterns, related to manifestations of endometriosis. The endometrial tissue, based on location, can cause a woman some difficulty with sexual activity, can cause a lot of pain. And so we want to make sure that we also offer support with pain management and maybe a possible help group with the woman to work through these particular diagnoses. Thank you. Now, let's talk about some research related to nursing interventions. As I mentioned to you guys earlier, this is something that is personal to me, and I did quite a bit of research to kind of find out what some facts and what some myths are out there about endometriosis. And believe it or not, although this disease is very common, there are a lot of myths and misunderstandings about endometriosis. So in September of 2009 till about January 2011, a study was performed on a gynecological unit towards nurses and attitudes with endometriosis. These nurses were caring for patients who were on a cancer unit, and they were also caring for patients who were on a unit specifically for endometriosis. And the study talked about a lot of things, but one of the main things that the study revealed was that the patients with endometriosis, their disease process was not considered as complex as those patients who had cancer. It also showed that the endo patients were categorized as being more difficult to deal with than the patients that had cancer. It also revealed the perception of the pain for the the nurses, as it relates to the patients with their pain, said that the endo patients weren't able to handle their pain as well as the cancer patients. And it even said that the women who were experiencing endometriosis were making these things up and that they possibly had mental issues. So overall, just as I stated when I started this particular information in the presentation, there are a lot of misconceptions. So the goal needs to be education and an understanding of what endometriosis is. And I think it's going to take us as nurses to really grab this by the horns and dig deep into it to give the world and to give physicians and to give patients a better understanding of endometriosis so that patients can have the best care. One of the biggest things that I want you guys to walk away with in this in-service is understanding endometriosis. Just as I talked about in the study, a lot of nurses are not aware. Endometriosis Awareness Month is in March, and the color is yellow. And I love this picture. It's a great depiction of what women with endometriosis suffer from. And the saying on this particular picture is that just because you can't see it doesn't mean that it's not there. I call upon all nurses and healthcare providers to understand and dig deeper and do a lot of research about endometriosis so that you can treat your patients and that they can have the ultimate level of care that they need. Thank you. All right, ladies, so this concludes the in-service about endometriosis. These are all the great references where I received the information about endometriosis. Please feel free to reach out. Please understand that there is ongoing research, as I stated earlier, with the Rose Group. If you do not have endometriosis or do not, if you know someone who does both, you can participate in the study. And let's just be very particular and take a very close look at women who are suffering from this disease and give a helping hand and change our thought processes as it relates to them. I hope you enjoyed and I hope you learned. Have a great day.